who are new to the channel, make sure to watch previous episodes of questions by checking the channel's playlist. So let's start with the today's questions. So the first question is, a nursing childbirth educator tells a class of expectant parents that it is standard routine to instill the ophthalmic ointment, form of which medication, into the eyes of a newborn infant as a preventive measure against ophthalmia neonatum. So, in this question, there is a nursing childbirth educator. Nursing childbirth educator means that provides informational and educational classes for expectant parents. Here the expectant parents means the woman who is pregnant. So here a nursing childbirth educator tells a class of expectant parents that it is a standard routine. Standard routine means written instructions about a particular process or procedure. That it is a standard routine to instill the ophthalmic ointment. Ophthalmic ointment means eye ointment, form of which medication, into the eyes of a newborn infant as a preventive measure against ophthalmia neonatum. So, in a particular question, here the nursing childbirth educator tells the expectant parents about the standard routine for installation of the ophthalmic ointment, that which medication is used as a preventive measure against the ophthalmia neonatum. So, what is ophthalmia neonatum? If we talk about the ophthalmia neonatum, mainly it is the conjunctivitis. It is the conjunctivitis. In it, inflammation of the conjunctiva can occur. It is a type of an eye infection that mainly occurs within the first 30 days of life, and usually it is due to the neonatal period of infant, and it is mainly transmitted during the vaginal delivery, due to the contact with the birth canal that is infected with sexually transmitted diseases or infections like viral or bacterial infections, and it may cause further complications like corneal perforation, and that may result in blindness if not treated. So here you can see the image that this is a ophthalmia neonatal. In this condition, eyes can be seen like this. So, which ophthalmic ointment is used to instill in the eyes of a newborn as a preventive measure of ophthalmia neonatum? So, to find out the correct one answer of this question, let's move towards the options. Here, the first option is penicillin. If we talk about the penicillin, penicillin is an antibiotic, but it is not a medication as a routinely used in the newborn. So here, penicillin is not used in the newborn baby as a treatment or preventive measure against the ophthalmia neonatum. And second one is neomycin. If we talk about the second option, neomycin, it is also an antibiotic but not used routinely in the newborns. So here it is also not applied here. And option third is vitamin K. If we talk about the vitamin K injection is mainly administered to the newborn at the time of the birth, and it prevents abnormal bleeding, and it promotes the liver formation of clotting factors like clotting factor 2, that is prothrombin, clotting factor 7, that is stable factor, and clotting factor 9, that is anti-hemophiletic B, that is also called Christmas factor, and clotting factor 10, that is stout power factor. So it is not used as an eye ointment. So this option is also an incorrect one here. And the option 4 is erythromycin. If we talk about the ointment erythromycin, it is a broad spectrum antibiotic, and it is used as a prophylactic measure for ophthalmia neonatum, and this erythromycin works by killing bacteria that cause infections. So here the right answer of this question is option 4, that is erythromycin ointment used as a preventive measure. Now the second question is, The nurse is reviewing the records of recently admitted clients to the postpartum unit. The nurse determines that which clients would have an increased risk for developing a puerperal infection. Select all that apply. So here in this question, the nurse reviewing the records of the client who has recently admitted to the postpartum unit, and the nurse determine that which of these clients would have an increased risk of developing puerperal infection. So here the puerperal infection means it is a bacterial infection of the genital tract which occurs after the birth of the baby, and these infections are mainly caused by bacteria like streptococci, staphylococci and escherichia coli. So here which of these clients have an increased risk of developing puerperal infection? Select all options that applied here. So to find the correct one options that are applied here, to move to the options first. So here the first option is a client with a history of previous infections. Here if we talk about the option first, a client with a history of previous infections have an increased risk of puerperal sepsis. This option is correct option here, because the client have any previous history of infection, then she can have risk of future infections, and she is considered as an increased risk for developing puerperal infections. And the option second is a client who has given birth to a set of twins. If we talk about the option second, a client who has given birth to a set of twins is not at the risk of developing puerperal infections. So here this option is incorrect one here. And the option third is a client who had numerous vaginal examinations. If we talk about the option third, in it there is numerous vaginal examination. A client who had numerous vaginal examination or recurrent vaginal examination can have increased risk of puerperal infection. This option is also a correct option applied here. And the option 4 is a client who has experienced 3 previous miscarriages. If we talk about the option 4, that is having 3 previous miscarriages, then the history of miscarriages is not considered as a risk factor for puerperal infection. So here this option is incorrect here. And the next one option is a client who underwent a vaginal delivery of newborn. The vaginal delivery is not a risk factor for puerperal infection. So this option is also incorrect one here. And the option 6 is a client who experienced prolonged rupture of membranes. Prolonged rupture of membranes are associated with puerperal infection. So here this option is also applied here. So the clients who have increased risk of developing puerperal infections are, first one is a client with a history of previous infections has an increased risk for puerperal infections, and the client who had numerous vaginal examination is also has increased risk for puerperal infections, and the client who experienced prolonged rupture of membranes are also have increased risk of puerperal infections. So here the option applied are option first, option third and option sixth. Here these three options are correct one options applied for this question, that these three clients are have more increased risk for developing puerperal infections. Now the next question is, after assisting with the vaginal delivery, what should the nurse do to prevent heat loss by conduction in the newborn? So in this question, the nurse assisting with the vaginal delivery. So after assisting with the vaginal delivery, what should the nurse do to prevent the heat loss in the newborn? that heat loss occurred due to the conduction. So what measures should the nurse use to prevent the heat loss in newborn that occurs due to the conduction? First of all, if we talk about the various methods of heat loss in newborn, so here there are mainly four methods of heat loss in newborns. And the first method is convection method. The heat loss occur from the convection method is about 15%. So in it, the flow of heat from the body surface to the cooler surface can occur. And the second method is radiation method. That heat loss occurs by radiation method is about 60%. So in radiation method, in this loss of heat from the body surface to the cooler solid surface, not in direct contact. And the third method is evaporation. Due to evaporation, there is a 22% heat loss occur. And in it, loss of heat that occurs when a liquid is converted into a vapor form. And the fourth one method is a conduction method. And in conduction method, the loss of heat from the body surface to the cooler surface in direct contact. So these four are the methods of heat loss in a newborn. Here you can see the neonatal heat loss. Then first one is convection. Here you can see the arrows of convection method. The heat loss due to cooler air circulating over the skin. This is the convection method of heat loss. And second one is evaporation method. Here you can see the loss of heat through the conversion of liquids on the skin to the vapors. This is the evaporation method of heat loss. And the third one is radiation. Here you can see the direct loss of energy from the body with a rate of loss proportionate to ambient temperature. This is a radiation method. And the conduction method, here you can see the transfer of body heat to the cooler surface, cooler object in contact with the baby. So these are mainly the methods of neonatal heat loss. And if we talk about firstly, when we caring for a newborn, how we prevent heat loss by convection. If heat loss occur by convection method, so how we can prevent it? We can prevent it by monitoring the temperature of the room, and secondly, keep bed away from the open window, fan or air conditioning vent. So by this way we can prevent the heat loss that occur by the convection. And secondly, and the another one is the radiation. What measures we can use if heat loss occur due to the radiations? So in it, if we can keep infant away from outside windows and air conditioners. So by this way we can prevent the heat loss from evaporation. And if heat loss occurs by radiation, and if heat loss occurs by evaporation, then we can dry the infant immediately after the birth, and when bathing, expose only one that area at a time, and drying the infant quickly and thoroughly after the bath. By this way we can prevent the heat loss from the evaporation. And by radiation we can prevent it by keep the infant away from the outside windows or air conditioners. And the next one is next we have how we prevent heat loss by conduction in the newborn. So this is asked in the question that what measure should the nurse can use if heat loss in a newborn occur by conduction. So as we discussed in the conduction, the heat loss mainly the loss of heat from the body surface to the cooler in the direct contact. So prevent it, we can use radiant warmer and warm blanket and warm stethoscope and warm instruments when used, and pad the weighing scale with a warm sheet before weighing the infant. So these all are the preventive measures that can be used to prevent the heat loss in the newborns. So let's move towards the options to find out the correct one answer of this question. So here in this question, what measure should the nurse use to prevent heat loss by conduction in the newborn? To find out the correct one answer, let's move towards the options. Here the first option is wrap the newborn in a blanket. So if we talk about the option first, then wrap the newborn in a blanket. If we talk about option first, there is a need of wrap the newborn in a warm blanket. Yeah, if wrap in cold blanket, it does not help to prevent the heat loss. So here this is a wrong one option, because there is a need to wrap the infant in a warm blanket. And the option second is close the doors to the delivery room. This method does not prevent the heat loss occurs by conduction method. So this is also an incorrect one option here. And the option third is dry the newborn with a warm blanket. And dry the newborn with the warm blanket. Newborn is dried with a towel, warm towel, not with a blanket. So this option is also incorrect option here. And if we discuss about the option number 4, place the newborn on a warm crib pad. This option is a right option here. This can help to prevent the heat loss in newborn that can occur by the conduction. So this method is used as a preventive measures to prevent heat loss by conduction method in a newborn. So here the right option of this question is option 4. Place the newborn on a warm crib pad. The next question is, after assessment and diagnostic evaluation, it has been determined that the client has a diagnosis of Lyme disease stage 2. The nurse assesses the client for which manifestation that is most indicative of this stage. So, in this question, after the assessment and diagnostic evaluation of a client, it has been determined that the client has a diagnosis of Lyme disease stage 2. So, now the nurse assesses the client for which manifestation or sign and symptoms that indicates that the client has stage 2 Lyme disease. So first of all, if we discuss about the Lyme disease, what is Lyme disease? So the Lyme disease is also known as Lyme borreliosis, and its causative agent is Borrelia bacterium. And Lyme disease is a type of infection mainly caused by bite from a tick, and it develops days to week after become infected, and it is mainly transmitted to humans through the bite of the infected ticks. And the symptoms of this Lyme disease includes various stages. So if we talk about the various stages, there are mainly 3 stages of Lyme disease. Here you can see the stage first of Lyme disease. The stage first is also called localized Lyme disease. Localized Lyme disease. So in this stage, the bacteria have not yet spread throughout the body. It is a localized to at a particular part. So symptom includes of stage first is there is a circular rash or erythematous rash may be seen in stage first, and there may be a flu-like symptoms that includes headache, fever, chills, lethargy and swollen lymph nodes. And these are the symptoms of the stage 1 of Lyme disease, that bacteria have not spread throughout the body in that stage. And the stage 2 is also known as early disseminated Lyme disease. If we talk about the stage 2 of Lyme disease, in stage 2, bacteria have begun to spread throughout the body. And if we talk about the symptoms includes in the stage 2, there may be a fever, numbness and tingling sensation, weakness in arms and leg, and sensitivity to light, cardiac dysarrhythmia, and neurological disorders like Bell's palsy or paralysis may be seen in the stage 2 of the Lyme disease. In that, the bacteria has start to spread throughout the body. So these are the symptoms of stage second. And next one is the stage third. Stage third of Lyme disease is also known as late disseminated Lyme disease. So in this stage, the bacteria have spread throughout the body, and the symptoms include there is a high grade fever may be seen, enlarged and inflamed joints may be seen, that is arthritis may be seen in the stage third of the Lyme disease. So this is Lyme disease and various stages of Lyme disease. Now let's move to the question. So according to the question, which manifestation after assessment or diagnostic evaluation indicates that it is a stage second of Lyme disease? So to find out the correct one answer, let's move towards the options. So here the first option is lethargy. As we discussed in the various stages of Lyme disease, that flu-like symptoms occurs in the stage first of Lyme disease, that is headache, lethargy. These are the flu-like symptoms that mainly occurs in the stage first of Lyme disease. So these both are the incorrect options here, because these are seen in the stage first of Lyme disease. And if we talk about the option third, that is erythematous rash, we also discussed in the stages that erythematous rash or circular rash can be seen in the stage first of Lyme disease. So this is also a incorrect one option here. It is also includes in the stage first of Lyme disease. And the next one option is cardiac dysrhythmias. As we discussed, the cardiac dysrhythmias may be seen in the stage second of Lyme disease. Cardiac dysrhythmias is the most serious complication in stage second. That cardiac dysrhythmias occur when electrical impulses of heart does not work properly. And the treatment that is given in case of cardiac dysrhythmias are antibiotics, stage second treatment that can be given in case of stage 2 Lyme disease is antibiotics like doxycycline and amoxicillin. Stage second of Lyme disease mainly develops in 1 to 3 months if stage 1 is not treated properly. So here the right answer of this question is option 4, that is cardiac dysrhythmia can be seen in stage second of Lyme disease, and the Lyme disease mainly caused by the bite of the ticks and mainly transmitted from humans through the bite of infected ticks. So cardiac dysrhythmias is the most indicative manifestation of stage second Lyme disease. Here you can see the various symptoms of Lyme disease, that it can be divided into two, early symptoms and late symptoms. So in early symptoms, these are appear mainly 3 to 30 days after bite. It includes chills, fever, fatigue, headache, stiff neck, rash development and flu-like symptoms. These all symptoms are seen in the stage first early stage of Lyme disease. And the later symptoms are, in later stage there can be bullseye rash, there is a meningitis, Bell's palsy, weakness in the limbs, severe fatigue may be seen, hepatitis, eyes inflammation and heart problems like cardiac dysrhythmias. These all are the late symptoms of Lyme disease. Now the next question is, the nurse is caring for a client with a diagnosis of pemphigus vulgaris. On assessment of the client, the nurse should look for which sign characteristic of this condition. So in this question, the nurse is caring for a client who is diagnosed with pemphigus vulgaris. When nurse makes assessment on that client, what characteristic signs the nurse notes that inclined, that is associated with the pemphigus vulgaris. So first of all, what is pemphigus vulgaris? It is mainly caused by the staphylococcus, and here you can see in the image, this is a picture of pemphigus vulgaris. It is a rare skin disorder that is characterized by blistering of the skin and the mucous membrane. Here you can see the blister formation on the skin and the mucous membrane of the mouth. This is the condition of pemphigus vulgaris. So the disease is mainly caused by problem with the immune system, which is the body's defense against infection, and instead of attacking germs, something goes wrong with the immune system, and it attacks the skin by mistake, and this damages the skin and causes blisters to appear. And if we talk about the main symptoms that seen in the pemphigus vulgaris, that is blisters on the skin and the mucous membrane, that is inside the mouth you can see the blister, on the nose, throat, eyes and the genitals organ. So the main characteristic sign of the pemphigus vulgaris is Nikolsky sign. It is the main characteristic sign seen in the pemphigus vulgaris. Here you can see the Nikolsky sign. In this, the top layers of the skin slips away from the lower layers when rubbed, and in it the easy to peel off skin can occur. And Nikolsky sign is a condition caused by staphylococcal infection, in which the superficial layers of the skin slips from the lower layers with a slight rubbing or pressure. So according to the question, which is the characteristic sign of this disease? So for the correct answer, let's move towards the options. If we talk about the option first, that is Turner sign. First one is Turner sign. So a Turner sign is mainly seen in acute pancreatitis, in which there is a grayish discoloration of the flank region can be seen. Here you can see the image of the gray Turner sign, that this sign mainly occurs in the flank regions and mainly seen in acute pancreatitis patients. This is gray Turner sign. So this is not a sign of pemphigus vulgaris. It is a sign of an acute pancreatitis. So Turner sign is a wrong option or incorrect option here. And the second one is Chvostek sign. The Chvostek sign mainly seen in the tetany or in case of hypocalcemia. In this, there is a spasm of the facial muscles caused by tapping the facial nerve in the region of the parotid gland. So this sign is mainly seen in the hypocalcemia or tetany. So Chvostek sign is also an incorrect option here. And if we talk about the Trousseau sign, the Trousseau sign is also seen in tetany or hypocalcemia. In this, carpal spasm can be caused by compressing the upper arm with the blood pressure curve inflated above the systolic pressure and causing the ischemia to the nerve distally. So Chvostek sign and Trousseau sign both are the signs of tetany or hypocalcemia. So this Trousseau sign is also an incorrect option here. So here the right option of this question is Nikolsky sign. In this sign, the top layers of the skin is slip away from the lower layers when rubbed, and in this condition the superficial layer of skin slip from the lower layers with a slight rubbing or pressure. So the Nikolsky sign is main characteristic features seen in the pemphigus vulgaris. So here the right option of this question is option third, that is Nikolsky sign. this is all about the today's video. I hope you all like the video. Stay tuned for the more such videos and thank you for watching the video.